So first I'm gonna start with the history. I'm gonna ask what the chief complaint is. So why it came in today. I'm gonna ask the mechanism of injury. So what happened to cause this injury. I'm gonna ask when it occurred. So when the instance occurred where he hurt his ankle. I'm gonna ask where it hurts. I could ask him to point with one finger to show me where it hurts the most. I'm gonna ask if there's anything that makes it hurt more, what activities he does that makes it hurt more, if anything alleviates it. I'm gonna ask if there's any popping or clicking, any pulling. And then next we'll go to the observation. So I'm gonna be looking at his ankle, looking for swelling, any discoloration, anything that looks out of the ordinary. And then after that, you'll look on both sides, you'll compare bilaterally to see if it looks different on the other side. Then we could start with the palpation. You start feeling just for temperature, feeling for swelling, anything. Feeling, in this case, just feeling around the ankle, trying to see where the swelling is. I'm almost there. So first I'm gonna start with the history. I'm gonna start by asking what the chief complaint was, so why he came in today. I'm gonna ask the mechanism of injury. So what caused the injury, what happened when he felt the pain in his foot. I'm gonna ask when it happened, and I'm gonna ask where it hurts and see if he can point out to me where the area with the most pain is, if he can use one finger. Then I'm gonna ask if he has any history with ankle injuries in the past. So in this case, it says that he has had a couple ankle sprains before. I'm gonna ask if there's any medications he's taking. Ask if there's any popping or clicking. Then we're gonna go to the observation. So we're gonna just look at the ankle, see if there's any discoloration, any swelling, anything out of the ordinary. You compare bilaterally to the non-injured foot. So in this case, it says he has some discoloration and swelling on the outside of the foot and then on the heel as well. So then for the palpation, I'll start by feeling around, feeling for temperature, see if I can feel any swelling, seeing if I can pinpoint, find what points feel most tender to pressure and touch. And start by just palpating all the toes, all the metatarsals, starting from the 5th metatarsal head, just going up through the 4th, 3rd, 2nd, and 1st. Feeling around, seeing if you could feel anything, if anything hurts, or if you feel some swelling or anything out of the ordinary. And feel up the dorsiflexion muscles, up the tibia. And feeling on the other side, feeling for the plantar flexion muscles. Feeling the tibia itself. Seeing if you're feeling anything out of the ordinary. You can feel both sides to compare. So in this case, where the swelling and discoloration on the outside, we'll feel around the lateral malleolus. Just feeling for any swelling. Palpating the ligaments around here, seeing if any of them are tender to the touch. Feeling on the inside, feel around the medial malleolus. And just feeling the deltoid ligaments to see if those are tender at all to touch. And then after palpation, we can do some special tests to see if we can figure out what the main problem is. So for the first one, we can do the squeeze test. So I'll start by squeezing the fibula and tibia and seeing if there's any pain on the distal head of the fibula. seeing if that causes any pain there. The next test I'm going to perform is the clunk test. Do this one by holding the bottom of the foot, supporting it, and then just applying light taps to the bottom of the heel, to the base of the heel. This one's testing to see if there might be a fracture or syndesmosis sprain. There's a fracture in the fibula or tibia distally. Next test that I'm going to do is I'm going to perform the talar tilt test, the E version and the inversion. Testing for if you feel any sort of laxity in there or if this is painful. You test this bilaterally to see if the other side feels similar. Next test I'm going to perform is the anterior drawer test. I'm going to support the lower leg and grabbing the base of the heel and pulling back, just feeling for any laxity or pain in this. I'm going to compare both sides. And with laxity and with this test would indicate a ATFL sprain or damage to the ATFL ligament. The next one would be the cotton test. So this one I'm going to be applying pressure laterally, feeling for any laxity or movement in the ankle joint. And then that's an assessment of the ankle injury.